Officials in North Carolina said today they'll impose a quarantine of at least 3 weeks on returning missionaries who worked with Ebola patients in West Africa. The outbreak in Africa is growing worse by the day, and Debora Patta has more tonight.
Medical organizations fighting to contain Ebola across 4 West African nations are being stretched beyond their capacity. With nearly 1,000 dead and almost 2,000 infected, a leading health official in Liberia told CBS News that they do not have enough beds to treat the ill. Many infected people are being left to die alone in their villages. In some cases, the bodies of Ebola victims are simply being dumped in the street. Researchers believe they have now tracked down the start of the virus to a 2-year-old boy from a remote village in Guinea who fell ill in December last year. But it wasn't until March that the mystery disease was identified as Ebola. By then, dozens had been infected. And on the front line of the battle to contain the deadly virus, it is health workers who are bearing the brunt. Scores have died, and a leader of Liberia's Health Workers Association, George Williams, says they are growing increasingly angry.
If you were to go into the isolation centers right now, you will see the number of our colleagues, health workers, who are now lying in isolation centers there from the infectious Ebola virus.
In Sierra Leone, a doctor working with Doctors Without Borders told CBS News the disease continues to spread. He said they don't have enough staff or space to assist those infected with Ebola, and there is a very real fear they will have to turn patients away. The countries affected by Ebola already have overburdened and often dysfunctional health systems. Health workers often do not have proper training or adequate protective gear. As one doctor put it, declaring a global health emergency is not enough. We need action, not words. Debora Patta, CBS News, Johannesburg, South Africa.